Who misses free and affordable ads and social networks without the anti-sex work rhetoric? Assembly 4 is a team of sex workers and technologists in Melbourne, Australia, aiming to bring back free and fair advertising and social spaces to the sex working community. They also give back to organizations based in harm reduction, sex work, and education. Stepping away from the clunky design of traditional platforms, their two products, Tryst.link and Switter.at, are refreshing and well-needed changes in both presentation and mission. Both are free to join and open to all. In the words of an A4 user, from the policies to the language to the advice and tips, it makes such a big difference to feel encouraged and supported instead of policed. Check out their website, assembly4.com, for the word and not the number, for more info. Welcome to the Peepshow podcast.
News and stories from the sex industry.
With Jessie and PJ Sage. Welcome back to another episode of the Peepshow podcast. Today, Peepshow intern Bella Cowan and I talk to sex workers and a doctor about the barriers for healthcare access that sex workers face. Okay, welcome back to another episode of Peepshow podcast. This is actually episode 99, which is so wild to say. I'm sure a lot of you already know this, but we are wrapping up Peepshow podcast. Next episode, PJ and I are going to give, for the 100th episode, we're just going to talk about the last 4 years. Also, we're going to make a little announcement. So you guys have to stay tuned for episode 100. We actually have a cool project going on. But for today, for the 99th episode, it is a special episode. So Bella Cowan has been the Peepshow intern for the last school year. So hi, Bella.
Hey.
So Bella is a Pitt student. She actually has been a student of PJ's. PJ's not here right now because she's technically my intern. And PJ is the faculty
advisor.
Person? Yeah. So Bella and I have been working on this project together. I don't know if you noticed, but last semester we wrote an article for Kinkley magazine up in an online magazine up in Canada, and it is about sex workers' barrier to good healthcare access, which is a project that Bella was really interested in as the intern. Tell our audiences a little bit about you and why you were interested in healthcare.
Yeah, so I'm a junior at the University of Pittsburgh right now, and I study microbiology, and I'm getting a minor in gender, sexuality, and women's studies, which is how I met PJ.
Yeah.
But yeah, so I've always been really passionate about where science and like social issues intersect. And I'm pre-med, so hopefully in the next coming years, I'll be heading off to med school. But yeah, so that's I've always been really passionate and interested in medicine specifically. And then once I kind of started studying a little bit more GSWS stuff, I just became a lot more conscious and passionate about barriers in general to healthcare for all people.
What Bella and I did over the course of the year is we interviewed 5 people. We interviewed a doctor who we will introduce a little bit later in the episode, who recently actually also did a study on barriers to access for care for sex workers, where she interviewed a lot of sex workers about how they disclose their work to doctors, whether they do that, why they make those decisions, how they make those decisions. So she talked a lot about what she gained from that study. And then we also interviewed for sex workers. This was the first time that you did something like this, where you actually interviewed people. What was that experience like for you?
I just learned so much from the entire experience, from pitching the article to interviewing people, from writing the article. I learned a lot, and the interviews were particularly interesting just because I've written research papers, but never done my own research for papers. So it was definitely an experience.
Yeah, it's very different to like read about people's stories than to like actually hear them tell it to you themselves.
Yeah, exactly. Just like hearing all the things that they've gone through as someone like who wants to be a doctor was just really eye-opening and like impactful, honestly.
Yeah. Did people say things that surprised you?
Honestly, no. It was a lot of what I was anticipating, just a lot of problems, a lot of neglect and discrimination, which is unfortunate. But I think the degree to which those people have experienced discrimination and lack of access to healthcare was surprising in a certain sense. Just the minimal good experiences they've had was so disheartemme.
Yeah. So you would say it was like disheartening, but you wouldn't say it was surprising.
Yeah. You know, I mean, like as a femme person, like who has received medical care, like I've had poor experiences. You know, I'm sure. Right. Yeah. So
yeah.
Like it wasn't.
I had a lot of life before I was a sex worker, and it still sucked, but it's worse.
Yeah. Exactly. So you know, it wasn't that big of a surprise that these people who, you know, have other intersecting like identities that are marginalized are experiencing even more hardships.
Yeah. So why don't we just like dive into the interviews? One of the sex workers we interviewed is Ava Adore. She is a sex worker out of Ohio, and not only is she a sex worker, but she's also one who has done a lot of advocacy, health care advocacy for other sex workers. She talked a lot when we interviewed her about going with her friends to doctor's appointments, about advocating for them, about telling them how to get disability, things
helping
like that.
Helping people advocate for insurance.
Yeah. So it was really, really interesting to talk to her. So let's start with her.
This is the most packed to the brim with chronically ill people that I have ever met. Yeah. Like I have EDS, which is a joint dislocation disorder, but comes with a bunch of other autoimmune problems as well as other crap. So, and it's really funny because this disorder is quite prevalent in sex workers. I always say you could throw a rock in a sex worker with EDS because we're everywhere.
It's so interesting that Ava brought up EDS because I didn't know about that until I got into sex work, and she's right. I know so many sex workers who have that particularly, but who have a lot of like different sorts of autoimmune diseases. And I think one of the things that Ava's trying to bring up here is that the sex work community is overrepresented by people with chronic illnesses, with chronic pain, with disabilities of various types.
Right, yeah. So not only do these people need to get health care related to their job and being a sex worker, but they also have other conditions that they're managing and need to get regular health care for.
Yeah. I mean, one of the things that I think is interesting is that when you hear discourse about like sex work or sex work related healthcare, like the thing that everybody is like thinking about is like STI testing and like HIV and AIDS prevention, which is very important, but it's also important to think about the fact that like that's not the only thing that sexual health isn't the only thing that sex workers are like interested or concerned about.
Yeah, these are people. They're full. They have full bodies, and you know,
not just full lives, but
like,
full bodies.
Right? They like have conditions, and even when you're healthy, I mean, like. You get sick, you have to go see a doctor. It happens to everyone.
Right. You know, it is true that sex work is overrepresented by people who are like marginalized in other ways. A lot of people, you know, who are anti-sex work want to claim that there's something about sex work that like, you know, breaks people or attracts broken people. But I think that anyone who spent very much time with sex workers, including Dr. Yasaswi, who we interviewed for this, is able to see that actually one of the reasons that sex work is overrepresented by people who are marginalized in other ways is that there's just like, it is a place where you can access employment and flexible employment to go around disability or to work around disabilities and other sorts of issues.
Right. Yeah.
Yeah. So let's listen to Yasaswi kind of explain how she came to that in her research.
One person sort of pointed out how some of these kind of intersecting pieces of marginalization kind of ensure that exchange sex might be the only work that society allows you to do due to like other experiences of stigma and marginalization that maybe like the world is not letting you have a different type of job, and this is the way that you can secure income. And how we both marginalize and then criminalize the experience we're creating marginalization around. It's like this true irony of American unequal class society.
Wow, she was so eloquent in her entire interview, but the quotes we got.
Yeah, no, Dr. Yasaswi is amazing. She's doing amazing work here in Pittsburgh. She's a Pittsburgh-based doctor. And one of the things that I really liked about what she was saying is that, you know, there's very real reasons why there are sex workers who have, you know, disabilities and other health issues that are why they're in sex work and why like our structures work to keep people in sex work too.
Yeah, exactly. I mean, like, it's well known that if you are not cis, if you are not white, that you have a more difficult time finding employment, keeping employment because of these other, you know, institutional factors at play.
Yeah, right. Yeah. And so I think one of the things that comes out of both like Ava and Dr. Yasaswi talking about this is that like, when we're talking about healthcare access for sex workers, we're actually talking about healthcare access for not just sex workers, because there's some people, we are not those people who will be like, you know, sex workers are a very marginal group. It's a small group of people. But actually, we're talking about access for healthcare for poor folks. We're talking about access for healthcare for disabled folks, for trans folks, for Black folks, like Black and brown folks. I think it's really, really important that we kind of situate this issue within a broader context.
Yeah, I definitely think it's important because it really just shows and I think reveals all of the flaws that so many other people are facing.
Yeah, so why don't we look at, like, more specifically, I mean, that's kind of the overarching picture, but why don't we look at more specifically about what issues the people that we interviewed said they had with healthcare?
Yeah.
All right, so one of the things that all of the sex workers that we talked about is the fact that they don't necessarily think that it's safe to disclose to all of their doctors their work history.
Yeah, that was a big commonality between interviews was this like anxiety or stress about deciding when it's safe to disclose, how to disclose.
Yeah, if it's safe.
Right, if it's safe,
Yeah,
like, and like weighing the options, like, will this impact my care if I don't disclose?
Right, yeah, so let's listen to Adrie Rose is actually also a Pittsburgh-based sex worker. We're leaning Pittsburgh here. She's a Pittsburgh-based sex worker and writer and photographer, and she talked a little bit to us about why she may be reticent to disclose.
As a Black woman, it's really hard to get competent medical care, and with being a sex worker, I think it would only be worse.
She brought up something that we keep talking about, which is that like most sex workers who are going into a doctor, like that's not even the only reason that things are hard for them, their sex work status. But Adrie went on after this to talk about like some of the specific, besides being a Black woman, like specific issues that she faces. So let's listen to that.
So my parents are immigrants and I hold dual citizenship. So a huge part of it is fear of deportation for them or me. Like, again, HIPAA doesn't protect criminalized behavior. And I know that a lot of doctors will say, well, you can trust me, I'm not going to disclose, not to doubt their integrity, but I can't take that chance. There's nothing stopping them from disclosing it. There's nothing stopping them from going to law enforcement.
Yeah, I mean, that's one of the important things that she's bringing up there is that even if an individual doctor will say, you know, I'm not going to tell anybody this, they're still keeping records that other doctors have access to.
Right, yeah, and I think that was another like big theme that came up in our interviews was just a general distrust of medical professionals for good reason. Like historically, there are reasons that people in a part of marginalized communities, feel as though they can't trust doctors.
Right. Yeah. I mean, we certainly saw this with like COVID vaccines, and while I was pro like vaccine, I also completely understood where, especially Black people were coming from when they were like, I don't know, like, why should we trust vaccines that got pushed forward, and there's a lot of reasons for that sort of like level of distrust towards like the medical establishment. So yeah, I mean, I think, if you do have immigrant status, if you are worried about, being deported like Adrie's parents are, or Adria's, I think that's a really real concern. Ava brought up another concern. So let's turn to her.
Well, for one, it goes in your medical record, and those are accessible to things like disability cases and a lot of other things. And it's just, I don't want that permanently recorded because it's not relevant to my healthcare with my chiropractor or this or that, or, it's not relevant.
I have to admit that that piece of disability didn't occur to me until Ava said that.
Yeah. I mean, like, so often we hear the motto, sex work is work.
Right.
And when you're on disability, you are not supposed to work.
Right.
So,
or you can only work so much. So it's not even just that, like, one of the things that Ava is bringing up is like, okay, so when you are on disability and you have to prove that you're disabled in order to get those benefits, one of the things that they do is look at your medical records, because that's how you would see that how you would verify that you're actually disabled. Well, what do you do when you say, I can't work because I'm disabled, and in your medical records it says I'm working?
Yeah, exactly. And it's important, I think, like in the United States, like what is, benefits for disability are so minimal.
So low. It's not even enough to pay like an average 1-bedroom apartment rent.
No, it's not livable at all.
Yeah. So, I mean, I think that piece is so important. Like, you don't want to proliferate among like different medical offices, like the chiropractor and like all of these different places that you're working, if what you're trying to establish is that like you can't work. And I mean, I think the point that you brought up, Bella, is really important, which is that like most people who are on disability, like almost everybody, I would say, can't possibly live on the disability benefits alone. They're so low. So, I know that's true in Pennsylvania. So people are doing side hustles to try to get by, and sex work is a side hustle for many people.
Yeah. You have to do what you have to do to
to pay your bills,
to live.
Yeah. So we also talked to Bryan Knight, who is a New York based sex worker, and one of the things that he talked about is how once you disclose that you're a sex worker, it kind of changes the dynamic between you and your provider. So let's turn to that.
Me and some workers, we deal with pressures like how much do we disclose to doctors, how much do we disclose to our mental health professionals, finding one that doesn't make us feel like shit or tries to make us exit or has like other agendas, or who like just listens and helps.
It's funny to hear the standard that Bryan is asking for, a doctor who just listens and helps. Like, that would be great.
The bare minimum.
Yeah, right. It'd be nice to find a doctor who listens and helps. I mean, that's what doctors are supposed to do. I think that one of the things that Bryan brought up, I heard a lot of people talk about when they talked about mental health care too, which is that like one of the things that happens with sex work when sex work is disclosed to professionals like doctors and therapists is that it often gets centered in a way that is outsized for the way that it's interacting with whatever you're there for. So what I mean by that is that, you go to the therapist and say, I'm as a sex worker and say, yeah, my husband and I got in a fight because he didn't take out the trash. And the therapist is like, well, how does he feel about you being a sex worker? And you're like, wait, what does that have to do with the trash, right?
Right, yeah.
Bryan is kind of talking about something similar. So what happens when you go in and say, like, my toe hurts, and they're like, wait, but you're a sex worker? So, like, how can we help you get out of that? And he's like, how's that going to fix my toe?
Yeah. I mean, like, and all of your problems get lumped into this one aspect of yourself.
Right.
And then like your care is significantly impacted.
Right. And so if you're there and you're trying to get help for something else, like disclosing that you're a sex worker may in fact be like counterintuitive.
Right,
Or
yeah.
counterproductive, rather.
Yeah.
Yeah. So the last sex worker that you guys haven't heard from yet that came on is Ember Fiéra, who is an LA-based trans sex worker. And she talks to us also about why, for her, she doesn't think it's necessarily safe to disclose. So let's turn to that.
Because sex work is criminalized, because it's so stigmatized, I don't think it's really good for a lot of patients to disclose that they're sex workers to their healthcare providers. I just don't talk about it. I'm just like, this is what I want done. And it's like, I really like now when I go to see a medical care provider, I do my research and I'm like, okay, these are like what I want done. These are the tests I get done. And I research everything and I just try and tell the doctor what it is I need. And I think that's like the best way to keep myself safe.
Yeah. So, I mean, everybody else that we were talking to was kind of bringing up the point, the different reasons why they didn't think that, or why they thought it might not be in their best interest to disclose. One of the things that Ember is saying is that, like, at this point and where she is, she's just decided that it's not safe.
Yeah.
And that she's going to do the research on what she needs and just inform the doctor of what she needs.
Yeah, I mean, like, within this, there are so many different reasons that disclosing may not be in your best interest, like, as we just heard. But I think it's easy to, like, lose sight of one of the biggest reasons is just safety. You know, like, it's not always, especially, like, in the U.S. right now with all the anti-trans and, like, gay legislation that's, like, going into... going on right now. I mean, like, yeah, it is not always safe when you are a part of these other marginalized communities to disclose, like, oh, by the way.
Yeah, I also am engaged in...
I'm also doing this other thing you don't approve of.
Right, yeah. How many things, on how many points do you want a doctor to disapprove of you? I mean, at that point, it just becomes, too much. And what Ember is saying here, I think, is completely fair, which is, like, she doesn't feel safe doing it. She's not going to do it. I think that, like, I think that both of us would agree that, like, that seems smart, and also that's a shame.
Yeah. It's sad to hear that, like, really the bare minimum that you can expect from a medical professional is just respect.
Right. So, yeah, I mean, I think that part of the reason for collecting these interviews and for talking to Dr. Yasaswi and for doing different, and for putting together this article was to kind of look at the problem and see, like, obviously this isn't ideal.
Right.
How could things change in order to make healthcare safe spaces for sex workers? Ember actually, like, later in the interview talked a little bit about how, she does now know how to ask for what she wants, to advocate for what she wants, but, like, she wasn't born knowing how to do that.
Right.
Like, sex workers didn't go to medical school. Like, like the fact that we have to then, like, advocate for, like, ourselves in a system that's supposed to be, like, for us is, like, a problem. So let's listen to Ember talk about a little bit about what that process has been like for her.
I think it's like now I feel like at a place where I can, navigate these systems much better. But I just know, that, like, there's years, that, like, I could have had, like, a very serious health issue and waited till the last possible moment to ever get treatment for it, And, like, I'm so glad that, like, I didn't have anything serious happen to me during that time. And I think it's just, like, this is how people fall through the cracks. It needs to be so much better.
I mean, one of the things that we said a little bit earlier is that, like, you may not want to disclose because it's not relevant. But I think that what Ember's, like, quote here brings out is that sometimes it is relevant.
Yeah.
And that the fact that she, or, earlier when she was younger and she didn't know how to navigate that, would have, not sought medical care for things that she needed medical care for is a real problem.
Yeah, exactly. And I mean, this is, like, part of the bigger issue of, like, medical care and, like, waiting until the last possible second
Right.
to receive care. For so many people, that's like what they're accustomed to doing because they're fearful or uncomfortable, or it's not clear what will happen if they do go to the doctor.
Yeah. So when we talked to Dr. Yasaswi, she brought this up as well and found the same thing in her study, that like the sex workers that she was talking to really did not feel like the medical system was there to help them. So why don't we look at that?
I think it's really important to convey how much they immediately knew that the system was not for them. That like from the person who checks you in at registration, from the phone call that it takes to make your appointment, the inflexibility around schedules, the dealing with pharmacy staff, that this whole structure, like people were telling me with great emotional intelligence, I know when someone is speaking behind my back or treating me badly or being racist or judging me based on my income, or I've told them that I have exchange sex and they have shifted their attitude towards me. And that at every step in this process, people very keenly feel that pain of othering or like rudeness or stigma or racism. And then they have to decide about dealing with this emotional inflict of pain or getting the services they need. Or having to fight for the services they need because people are declining them. Like saying, I'm out of stock for PrEP because I know who you are, you're Black or whatever. I mean, and I don't say whatever to minimize that. I just mean that I think that declining services to someone is crazy. And I think that it shouldn't happen ever. But it's clear that it does.
One of the things that I love about the way that Dr. Yasaswi talks about her patients and the people that she talks about, that she talked to for her study is how everybody actually deserves healthcare. And everybody deserves to be respected, and that denying access to care because you don't agree with their life choices or their sexuality or their job choices is just like absurd.
Yeah, I mean, I can't even imagine. Just like it's difficult to wrap my head around because these are people at the end of the day, and this is the community and the people that you should be prepared to serve when you go into positions like this. But unfortunately, that clearly is not the case.
Yeah, I mean, I think that one of the things that all of these interviews thus far have been bringing up is just how stacked against the sex work community, like the medical institution is.
Right, yeah, and I think that just goes back to the fear around disclosing and the distrust of doctors when, you know, like Dr. Yasaswi found, they know that the system is not for them. Like, as she said, it's not for them.
Yeah. So another thing that came up in our interviews was the way that doctors interact with police and report things to police, which for sex workers, particularly the sex workers who are doing criminalized labor, that's obviously a problem. So maybe let's turn to that.
Yeah.
I have thankfully never been assaulted while working, but a couple years ago, I matched with a guy on Tinder and we hooked up. It didn't go well. He was a lot bigger than me, but I ended up going to the ER and I got interrogated about what had happened, and people just were not taking me at my word. I was like, it was fine. It was completely consensual. It was a one-night stand. It just didn't work out great because he was a larger guy. They called the police, even though I asked them not to, and like my insurance company got in on it, and people just were not taking me seriously. I think it comes down to, there's a very common attitude, not just among doctors, but among people in general, that, I don't know, when you do sex work, agency doesn't seem to register for people. It's like you're incapable of making decisions for yourself. If I had been assaulted, I would have said that, but I wasn't. But because there's like a flag on my medical records that says she's a whore, like people just assumed, oh, she got raped by a client.
Oh, that's so horrifying.
No, like genuinely, and especially as a Black woman, you know,
right.
like that is terrifying to have the cops called
Right.
when you are explicitly saying no to that. And I think her point
Right.
about agency is so important and like really
Yeah.
plays into that.
It really is. It's like, we were saying earlier in the episode that, like, once you say you're a sex worker, like, everything gets boiled down to and reduced to being a sex worker. And I think Adrie is displaying that really well, saying, like, even when I'm like, I have a dating life.
Right.
I hooked up with somebody on Tinder, and that's why I'm here. And this has nothing to do with that, like, horse stamp on my chart, which I'm pretty sure I have a horse stamp on my chart too, by the way. But like, I think that like they wouldn't even take her seriously then because everything gets boiled down to like the horse stamp.
Yeah.
We also talked to Ava about this, and Ava talked about the fact that, there are rules in place to stop this from happening. But we, going back to Adrie talking earlier about just, not having a general distrust, like, how do we know that those rules are going to be held up? So let's turn to Ava.
There's very limited issues where they could even then they can't release your medical records to the police. They cannot, but doctors, they break HIPAA all the fucking time.
Okay. Mm-hmm.
Part of something that, me and another friend of mine have had experience with is cracking humans, and getting through humans is really, really easy. Mm-hmm. Doctors and nurses and hospital staff break HIPAA every day, all the time, without even realizing it.
Yeah.
Yeah.
I mean, like, I'm not even sure what to say about that, except that, like, one of the things that this keeps coming down to is that when you have a marginalized identity, like being a sex worker, you can't assume that people are going to protect that with the same care that you would protect it with.
Yeah, exactly.
Yeah. Adrie brought this up, actually, because she was talking a little bit about how this is really hard. This issue of having your information spread around is really hard in a city like Pittsburgh, where, like, we have a huge hospital network that's all connected to each other. All the system is entirely connected,
right.
Which makes anything that any one doctor says about you accessible to every other doctor that you have. Adrie was talking a little bit about how it was easier in Miami, where there was ways to go to the doctor anonymously. So maybe let's look at that.
Yeah.
Simply because of the population, there's a lot of undocumented migrants. There's a lot of transient people in Miami. Receiving healthcare anonymously is a lot easier. And obviously, when you're working in a criminalized profession, anonymity is crucial. So getting STD testing, getting into a free anonymous clinic for healthcare in Miami is much different. It's much easier. It's much simpler. No one asks you for ID. No one asks you for health insurance. They just ask if you can pay or not. You can pay in cash, those sorts of things.
Yeah. So, I mean, I think that what she's saying there is like really important. It's actually hard for me to imagine going to the doctor and not giving an ID.
Yeah, I was just about to point that out too. Like, I have never lived anywhere where there's like a high population of people who are coming and going, so it's a little bit more common practice, as like what she was describing in Miami. And so it's hard for me to imagine medical care like that, and I want to be able to imagine.
Yeah, but why couldn't
like
it be? I mean,
right? Like,
yeah, I was thinking that too. I was like, I can't imagine just being asked like what test I want and not my name or anything, but like, why not?
Like, what does your name have to do with it? Getting on birth control or whatever you need, whatever test you need done. I mean, she continues on and brings up, like, once you remove that anonymity, it makes it so much more difficult for people to bring themselves to doing that. You know?
Their full selves.
Yes, like it's a very difficult and a very vulnerable moment for a lot of people.
Yeah. I think that was a really important point, and interesting for me, who's never seen healthcare practice like that.
Yeah.
So seems really important.
I think something else that is really important to address, in terms of safety, and, we've talked a little bit about like discrimination that these people have faced when they've disclosed being a sex worker, or, you know, just having other outwardly presenting identities. But for a lot of these people, sexual harassment and just harassment in general is a very real possibility when seeing a doctor.
Right, especially once disclosing that you do sex work. There's a way in which sex workers are like hypersexualized, as if like just doing a job in sexuality is an open invitation for everyone to share their sex lives with you. So let's look at Ember, who talks about her experience with that.
There was like one doctor who would be servicing all the trans women, and then he would just sexually harass all the girls. That wasn't even the first doctor to sexually harass me. And so like I'm like there, and then he is trying to be friendly and nice, and I'm like, okay, I need to get this doctor to like me because I need these services, you know. And then, you know, he's making jokes and stuff, and then, you know, la da da. And then all of a sudden he's like telling me about his sex life and his sex life with his like wife, and like all of like the orgies he's been to. And I was just like, oh no, like this is not what I came here for. You know, we're not dating, you know. And you know, and I kept trying to see other doctors, right? And they kept funneling me back to him. And then I eventually, like, he was even like calling me on my personal phone number, you know. And then I kept trying to see different doctors, right? And I kept telling people at this place too. I was like, this is not appropriate. You know, I told like my therapist that, and like as I'm telling like my therapist there that I was like having to see to get an official diagnosis for gender dysphoria, he like stops me like in the middle of like me talking about stuff and be like, what is your race? And I'd be like, I'm Filipina, white. And then he's like, oh, very beautiful, very beautiful. I was like, I hate this. You know, and yeah, and so and no one was taking my complaints seriously. So then after like years of this happening, and like I would set up appointments with other doctors. So then eventually, like I even took it to Facebook. I even like started tagging them and being like, this is not appropriate. And then once I did that, all the other girls in the trans community started posting saying like, he said this to me, he did this to me. Other people who worked there said this.
That's like fucking terrible.
So much to unpack with all of that. I mean,
yeah. I mean, it's you know, I think there is a way in which like sex workers get hypersexualized in all of our like interactions, so that people do start saying like inappropriate things, or like assuming that you want to sleep with their husbands, or that like you want to hear about their like sex life or whatever. But I think that it's even more problematic when it's you going to like a professional and trying to seek care and not being able to get that because the doctors like can't get out of their own way and actually be professional enough to give them to you.
Right. I mean, and like outside of like the medical aspect, this is a professional in their job and in their career in their field, and they can't, something about a trans woman, a sex worker is so just overwhelming that they can't even be professional and act like a regular person.
Right. Yeah. It's really disappointing. Bryan actually talked about something similar and said, while he hasn't had doctors who've like harassed him in that way, he does know other people who have. So let's turn to that.
The doctors have been like, well, use like the basics, like use condoms, get regular testing, like pretty straightforward. I've been fortunate. I haven't had a doctor like shame me for like STDs, but I've had friends who've been like, I've been to this doctor and I'm not going to him anymore because I'm really uncomfortable with it, especially when I mention what my job is. So
one of the things that I think is so interesting about that is that clearly there's like a gendered aspect to this too, because I actually can't imagine not being shamed for STI testing. Like even though that's something that like, you know, as a sex worker, I do like. I don't by the clinic that I go to now, which is very like sex work affirming, but it took some time to find that. And I feel like it's really, really difficult for women, or for femmes, or for trans women to seek out like sexual health care and not have people question why they would need that.
There's stigma around that. Being a sexual being as a woman femme presenting is difficult. There is stigma associated with that.
Yeah, like I never, like, it's interesting to hear Bryan say that because, like, I don't think I've ever had a doctor just be like, oh, just use condoms and everything's fine. Like,
right, no. Like, even trying to get access to birth control and other, like, reproductive health for
our bodies.
is incredibly difficult.
Yeah. So that was really interesting and illuminating because I think that, like, as women and as, like, femmes, we, like, have this feeling that we're being treated unfairly, and then to, like, but don't have the other side of it.
Yeah.
And then to have, like,
to hear that validated by someone who's, like,
at least aware that,
right. Yeah. And he's like, I have this privilege and I don't experience this level of discrimination.
Yeah, that's really, really interesting to hear. Yeah, so one of the things that actually both Bryan and Ember bring up is the fact that, you know, in the absence of good medical care from doctors, a lot of sex workers are advocating for themselves and turning to each other for that.
Work. The support system.
Yeah. Which, I mean, is true of a lot of communities who don't have access to institutionalized resources, have to turn to each other. But let's look at, first, Bryan talks a little bit about a friend of his who's, like, kind of been stockpiling resources for himself and for people in his community.
One of my coworkers, he had PrEP and Z-Packs on hand, ready to go. He had medicine stocked up in case he had an HPV outbreak. He had tricks for sterilizing his urethra in case of bareback sex. He had numbers ready to go in case of emergencies, like injecting too much Trimex, like medicine. Like, he had all this stuff, and it would have been awesome if he shared it, but he had it because he had done all the research on his own, like picking, like, he would be a great teacher, but he keeps the knowledge either for himself or to whoever happens to ask. But doctors would really benefit from talking with someone like him who has, like, all these things lined up. That would be a generally good, like, care protocol. Like, okay, you're doing sex work, here's a pamphlet, these are the things that you should have in your med kit, these are your general emergency numbers, these are, like, your general circumstances, like, basic stuff. Like, let's say you think you've been exposed to HPV or HIV. Where do you go to get the medicine to help you immediately afterwards?
Yeah, I mean, one of the things that he brings up that I think is really important is that a lot of sex workers are doing this on their own, and that they're doing it based on sex workers' needs. So one of the things that doctors could do to be better doctors for sex workers is to listen to sex workers.
Right. Yeah. I think, like, these are professionals, have gone to school for this. So there's a level of, I think, like, implicit trust that we give to them, to, like,
to doctors.
Yeah, to doctors, to care for our needs and to be able to deal with our needs. But in absence of that, we have to turn to each other, and we see that in the sex work community, as Bryan was just talking about with his friend who hasn't gone to medical school, isn't a medical professional, but still has all this knowledge and resource and tools that is really beneficial.
Right. They say that, like, there's this old saying, I think my grandfather used to say it, that, like, necessity is the mother of invention, right?
Yeah.
Like, if you can't just go and talk to your doctor because of all the reasons that we've said before, you have to figure out how to work around them. And so I think that, the best case scenario is that doctors and sex workers could actually work together to do these things.
Yeah, kind of like he's describing. I mean, like, if doctors could go to his friend and get the care pamphlet.
Yeah, and I mean, there's been a lot of efforts to do that. I know that, like, the organizing group Swap Pittsburgh has put together, like, a resource guide and has been trying to work with, like, the medical community and doctors like Dr. Yasaswi. But, like, there's so much work that needs to be done.
It's difficult, and it's unpaid work.
Yeah, exactly. That's
so
another
much
thing.
Of the time.
So much of the time, it's unpaid work for professionals who are making lots and lots of money.
Yes.
Where the doctors are actually getting much more out of it than the sex workers are.
Exactly.
So let's look at what Ember says about community.
So I think, it's like we really just have to remember, like, we have to turn back to community if we want to get shit done. It's like these bureaucrats and stuff. Like, yeah, there's like well-meaning people, in positions and stuff, but they're not designed to like keep us safe.
Nobody here that we talk to would claim that like every single doctor is bad, but what they all have claimed is that this system is not for sex workers. It's not built for sex workers. And even like Yasaswi, who works within the system, is also saying this isn't built for sex workers.
Has acknowledged that and understands that and sees the flaws.
Yeah. So let's turn to like, we talked to in all of the interviews that we did, we talked about, what would make what would make things better? What would make things better? I mean, one of the things that a lot of people talked about is the fact that like listening, that we've already brought this up, but listening to sex workers is one of those things. But let's listen to Adrie talk a little bit about that.
I mean, I think the most important thing is believing people. It's a huge part of agency, but also harm reduction in the most general sense. When people tell you what they need, it's probably best to just take them at their word.
I love that. It's like so simple.
I was just, yes, like it's really that simple. We keep coming back to this, like the bare minimum is not being met. Like,
yeah, right. Yeah, I mean, I think that, was it Bryan or somebody earlier who was like, just listen. And why is that not happening? But it feels like everybody was talking about the fact that what they're looking for is just actually like pretty small.
Yes, like someone who can care for you and who wants to help you.
Yeah, right. So Yasaswi had a little bit to say about that. So let's listen to her.
And I think that, one other part that's important is to not like immediately label someone as having a traumatic past. And letting that person tell you kind of what their needs are, kind of leading with a person-centered approach. I think that there's a tendency around a lot of different marginalized issues to like think that maybe pity is a good place to start to empathize with someone, but that's terrible. That's like re-victimizing. It's really condescending. It belittles someone's like entire identity. And instead, I think to recognize like the strengths in the person that's sitting across from you and start to engage with them there. Because it does take a lot of strength to like live, first of all, but second of all, to live with chronic experiences of marginalization. That takes a lot of strength.
Absolutely.
I just love that. I mean, it truly does. It takes so much strength.
Yeah. Yeah. And I mean, I think that what's so important that she's saying is that like, again, we're just going back to the bare minimum. Like, listen to what people need. And if more doctors were doing that, it would be much, much easier for sex workers. So, a lot of Ava, like going along with listening, I think that another like thing that came up is that what a lot of sex workers, what would make them feel much safer with medical professionals is being treated with respect. So Ava talks a little bit about that. Let's listen to what she has to say.
Treat us like a human fucking being, because so much we don't even get that respect. Especially street level and survival workers. Like they don't get the same kind of respect, if any. And the one place we should be able to find that acceptance and respect is healthcare. And that is an umbrella of mental health care, dental health care, physical, internal, all healthcare, period.
Yeah. I mean, one of the things that Ava brings up here that we haven't really talked about or touched on in here that I think is really important is that there are sex workers who are doing a lot of different types of work, and that it's even harder for more marginalized sex workers. So for sex workers who are doing more dangerous work, who are straight-based workers, who are poor sex workers, we've talked about how, there's a lot of different intersecting identities that happen within any given sex worker, but it's also important to talk about class and to talk about how those things impact sex workers and their access to care.
I think like in Ava's interview, she also like touched on like schedules and inflexibility and just the idea that you can't make an appointment because you have to work or else your lights will be turned off.
Yeah, I mean, I've dealt with this. I've canceled doctor's appointments because when you're a sex worker, you take work when you can get it. And, I don't have my month calendar set up, and then I'll get a job the day of a doctor's appointment, and the money is more important to me than
how are you going to pay for the doctor's appointment?
Right, exactly. And so there's a lot of ways in which sex workers are also dealing with these very
they're difficult choices and the compromises that they have to make to either get health care or continue to survive.
Right. Yeah. And I think that those are all really important. So Yasaswi touches on this too. So let's listen to what she has to say.
Yeah, I mean, I think the biggest thing I've learned is how important it is to advocate for kindness. I think that what I was saying before about how easily people understand when you have stigma or bias against them, and how it shuts down everything moving forward from that initial communication or impression in a world where people feel like they're combating for the things that they need for trust, and to immediately be told I don't trust, I don't care for you in a moment when they're being vulnerable. I just was like, wow, it's made me an advocate and stronger at communicating that to other healthcare professionals. And so I find myself asking the people around me, if you feel like you're getting that feeling, I don't want to give this person my time of day, I would really implore that you investigate why you think that that person doesn't deserve your time of day. And then that's a really good signal to understand your own bias and then work against it. And I would ask that you kind of dig deeper and step over that initial reaction and actually be kinder than you thought was possible.
I love that. I actually think that's advice for everyone all the time.
Yeah, I mean, just so important. And I think it goes such a long way, a longer way than people really think. Because it is, like she's saying, it's intuitive. People can tell when you don't like them.
Yeah, right.
That bias comes across and
don't approve of them or don't approve of their jobs. And how is a patient going to be open with a professional that they think is judging them?
Yeah, and I love that not only is Dr. Yasaswi, engaging with the sex work community and sex workers on a personal level, but she's taking this to her colleagues and having these conversations with them. And I just think that's so important.
Yeah, I mean, it's interesting. It's interesting to hear her talk because I feel like one of the things that's kind of under the surface of what she's saying is that having all of these conversations with sex workers has radicalized her in a way, which is awesome. And I also totally relate to that. Coming into the sex work community, I was never anti-sex work. And I know that she wasn't either because I've been I consider her a colleague. I've been following her career along the way. And she did not come in with an anti-sex work feeling, but I do feel like she's become an even stronger advocate throughout this process because it's really hard, or you have to be a very closed person to have to interact with sex workers on a personal level, to talk to them about their struggles and to not see what the problem is,
Yeah, to listen to these lived experiences of the trauma that's been experienced by them, just trying to receive health care, a right for everyone.
Right.
It's to not have that make a difference.
Yeah, in how you're doing. So I mean, I think that's really great. She also talks about breaking down stigma, and I think it will be important. One of the things that we haven't used this word much actually, but throughout this episode, but we probably should, we're dealing with stigma. That's what's happening here. And I think that Yasaswi brings us up. So let's turn to that now.
I mean, the next study is to do observational work amongst healthcare systems and to try to really break down where is our stigma being communicated and how can we change that or move that needle. I haven't done that study yet, I would say that from my perspective as like a brown woman in medicine and the stigma that I have seen or experienced, it is in the like nonverbal communications or verbal communications. It's in body language, like the way that people either turn towards you or sort of are quick to turn away from your requests. I think that if we can extrapolate from studies around like pain amongst Black women, we know that they are less likely to have their pain treated or less likely to have their pain taken seriously. And I think that, like we talked about related to my study, people's identities are intersectional. They aren't just Black women. There are many parts of themselves. And I think the same is true here for people who exchange sex. There's many identities they're presenting forward. And so if there's overlapping identities that have experienced marginalization, I think those are also associated with stigma. And so these different kinds of communication efforts can communicate that stigma resoundingly.
Yeah, I mean, I think that's so important, and I also very much appreciate that she recognizes that it's in the small things.
Yeah. I something else I appreciate about that too is that, like, not having any experience, like being a sex worker or in the sex work community, she's still able to relate her own experiences of stigma, like being stigmatized.
Yeah, what that feels like.
Yeah. And like, I think keyword empathy and extending that grace is so important because, you're not as far removed as you think you are from these like feelings and experiences that sex workers are having.
Yeah. So, I mean, she's talking about things like broadly, she's talking about kindness, she's talking about anti-stigma, but, a lot of the people that we were talking to were also talking about like more practical and concrete things that can happen. So Bryan, for example, was talking about putting up signals that the space is sex worker friendly. So let's turn to that.
I mean, having the red umbrella definitely is like, okay, definitely that's like a safe space symbol. Do you remember when we were kids and they used to have stickers on stores like this is a safe space or safe haven? Yeah, so just it like visually very helpful and didn't so people who are in the know to ask for it.
Yeah, so I mean, for those that are listening that aren't super familiar, like the red umbrella is a sex work solidarity sign. And so I like Bryan's suggestion that like, putting a red umbrella like on, one's desk, or sticker of one, doesn't signal to anyone who's not a sex worker anything.
No.
But for the people who, are sex workers, that could be really meaningful. I at the clinic that I go to, there was actually a sign in the bathroom that said, "We support sex workers. If you're a sex worker and like need resources, come to us." And I was actually really excited because I took a picture of that and sent it to my swap friend and was like, "Look at what this has." And she's like, "Yes, we did that." And I was like, "Oh, okay."
Oh my gosh.
So it's great that you all are organizing. It's working because now I'm a patient there. But, just seeing that was signaled to me that it was okay to talk about my history. And I mean, there's lots of reasons like why it's not okay. And so I'm not, I also recognize that I'm coming from a privileged position and I am a white woman. I'm a white educated woman, and the risks are going to be lower for me because of that. But I do think that like that is a step toward making things better.
Yeah. I mean, we've talked a lot about like being seen in like such a negative light, like being a sex worker and entering like a healthcare space. There's like this feeling of negativity surrounding you and what you do. But just being seen in like a positive way, like we see you, we hear you, if you need help, come, is so impactful and like just so good. Like, I don't know.
Yeah. So that's practical. Let's see. I mean, I think it's interesting to see, like Ava talks a little bit about what she thinks the ideal situation for healthcare would be. So let's turn to that.
Healthcare ideally for us would, one, not give a fuck what we do for work, not record it, not write it down. It's not relevant. sex work healthcare would ideally be based from a place of harm reduction, which is where I come from. Which is, going to the community, the places that need it most, going to the track, having a medical van there, and starting small, by just, rapid HIV tests, handing out condoms, handing out gloves, handing out just all the basic safety things.
Yeah, I mean, one of the things that is so sad to me about what she's saying, because I absolutely agree. I think that like harm reduction should be, a number one goal of not only sex workers who are working in their community, but also of medical professionals. But the thing that's so sad about this is that we live in a world in which like legislation now is making like so much of that harm reduction work really, really difficult, and in some cases criminalized. And that's a topic.
It's frustrating.
It's frustrating because that's a topic for a whole nother show that we don't have time to get into that. But I absolutely agree with that. And I kind of grieve the fact that we live in a world that makes that so hard.
Yeah. I think I definitely agree with what you're saying. I think something that I appreciate from her is that, it's very easy to like ask sex workers like, well, you have to have medical care, like you should be the one breaking down these barriers and going in and educating your doctors and stuff. But I really appreciate that she is, flipping the script and being like, doctors should be going out and making the effort to go into the sex work community with medical care supplies that are relevant to them and what they need. And not asking them to come in and take time off of, what they're doing in their lives.
Right. Yeah, I mean, one of the things that, and you brought this up earlier, and I think it's so important, is that, like, sex workers are not, like, a salaried group of people.
Right.
It's not like we have, jobs that are 9-to-5 jobs that we get a paycheck for. Like, sex workers are more akin to like people working in the gig economy who are like only getting paid for like the work that they're doing. And harm reduction work is not one of those things, like, unfortunately, for the vast majority of people who are doing it. So a little bit of like assistance
goes a very, very, very long way.
And money, direct money and resources to communities who need them. Because one of the things that I think has become like crystal clear, like through all of these interviews, is that like sex workers actually know what they need. It's not as if they're like floating around with like no sense of how to take care of themselves. Like, actually what we're finding is the very opposite. Like, with the given the fact that they don't have a lot of access to institutionalized care, they've had to figure out how to do it by themselves, by ourselves. And so I think, taking that knowledge, taking that community knowledge seriously, and pumping resources into it, I think
just
is
adding
really
to
important.
what they already have and are already doing goes so long.
Yeah. So Yasaswi also wanted to talk about what she thought would be ideal. So let's turn to that.
How can we be creative about this system where it's not your doctor that's providing these services, but perhaps some other entity entirely? And maybe the job of the American health system should be to like fund or support pre-existing healthcare.
Yeah.
That's, what we just said.
Yeah. I actually forgot that that's what she said. So
yeah.
It's funny, but like, I think we anticipated that because that's my feeling from coming out of all of these interviews.
Yeah. I think that's something that I did, definitely did take away from all of our interviews is that there is no one solution to this problem. It's so much bigger and broader, and all of these people are individuals with individual needs. And so by, not only saying, doctors need to be doing better, they need to be creating safer spaces, but we should be also allocating resources to the sex workers that are doing that work.
Right. Yeah. Yeah. And I know, what you just said, I know that Yasaswi came up with like a similar conclusion from her studies. So let's listen to how, she articulated that, because I think we're, very much on the same page with that.
Maybe a similarity of the study findings is that people are very individual and they wanted to be able to communicate their very individual needs in the time, in the place that they needed them. Some people describing that, online based access to healthcare providers felt good, and other people saying like, I feel like it's so impersonal and I need to see a doctor in person, and other people describing that they felt really good about condom use, and other people just discarding that entirely. And I would say that, borrowing from like contraceptive studies, that there is this push towards choice being better, that the goal maybe isn't to find like the one contraceptive that fits all people that are choosing contraception, but rather that having many choices available easily and accessible is really important.
That's a good analogy.
I think that really just ties in everything that we've been talking about, that these people are not only sex workers, but other parts of themselves with other identities that have needs.
Yeah, I mean, I think that that's a really good note to end on. I guess I want to ask you, like, what was the most, like, we kind of touched on this at the beginning, but like wrapping all of this up and kind of listening to all of these like bits of these interviews in succession, like what stands out to you the most, or what do you feel like you'll take like with you as you go to medical school from this?
Yeah, I think empathy. I think understanding, even if you don't know where someone's coming from and the position they're in, because it's not what you've experienced or what you know to be true, doesn't mean that you can't extend that same empathy and understanding to them. And I think also something that I just kind of was touching on a little bit, but a big takeaway for me, I think also, was just that there isn't a one size fits all. I think going in, I kind of had that idea like, oh, maybe we'll come out with a solution to solve the sex work and medical access issue, we'll do it. But I think so clearly that there are a lot of ways to go about this, and a lot of different ways, concrete, abstract, and daily practices.
And relational.
Over time, relational. I mean, like, there are so many different ways that today people can start creating safer spaces for sex workers.
Yeah. That's really, I think that's really great. And I think that we heard that all along. Like, everyone was sharing similar concerns, but the way that Adrie and Ava and Ember and Bryan, like, their needs are not the same. They're coming from different backgrounds, different places. Adrie's the only one that's worried about immigration. Like, Ember's the only one that's worried about trans
Ava
issues.
has disability.
Yeah.
Like, I mean, these are such, and I think that too was, it's like sex workers all get lumped together. You're like, you're all sex workers.
Yeah, but
just in this small group of people, there are so many differences between them and what they need and what they want.
Right. So, like, one of the things that, Adrie was talking about is having like anonymous care. And for other people, maybe anonymous care isn't what they want. They want something very personal, So I think that having a variety of options, like with this birth control like analogy, I think is having a variety of options that start from the place of empathy and care.
Yes.
Yeah. Okay, well, thank you for spending the semester with us.
Yeah, thank you for having me.
Or the whole school year, actually.
The
whole school year. But it was really amazing. I love the influx of like new ideas. I mean, I know a lot of you probably listened to the episode on healthcare or on mental health that we did last year with our intern last year, but it's really it's been great for Peepshow. And I say this as Peepshow is wrapping up, to have like interns that come in and bring their own like research interests. And PJ and I have always been like super stoked to incorporate that into Peepshow. And we're also grateful for the audience that comes along for the ride with us.
Thank you for joining us for yet another episode of the Peepshow podcast. I'm PJ Sage, and you can find me on Twitter at PeachSage.
And I'm Jessie Sage, and you can find me on Twitter at sapiotextual or at jessiesage.com.
We would like to remind you that we have a Patreon account and would appreciate your support. Please visit patreon.com/PeepShowPodcast. Our music is courtesy of Joe Kennedy. The show was produced by Jessie and PJ Sage.
Signing off. Have a great week.